Good evening, everybody, and welcome to another episode of Kettering Chats. My name is John Stamper from Medcast Productions, and it's always a pleasure to be with you here this evening. These health chats have been really awesome every month. We have been able to have clinicians on and talking about relevant topics, and the engagement has been amazing in the comments thread, and we would like to encourage you to do the same thing this evening. So Dr. Schoonover and I are going to be on here for about 30 minutes. We would love to have you post your questions in the comment section, and we'll be sure to answer as many of them as we can. So tonight's health chat is stroke awareness and prevention, and very honored to have with us this evening Dr. Schoonover, who joined DCND in 1996 and is a senior partner at the practice. He also serves as vice president of clinical quality. Dr. Schoonover's drive to help people brought him to medicine and neurology. In the office, he has a special interest in botulinum toxin for treatment of movement disorders and refractory migraines. He helped initiate and was instrumental in developing the stroke program currently in place at Kettering Health Network hospitals. Now, Dr. Schoonover is also very committed to helping educate medical students and residents as a faculty member of the Grandview Medical Center Neurology Residency Program. He is married, has 2 daughters. When not working, he enjoys spending time with family, golfing, and being an active member of his church. Dr. Schoonover, thank you so much for joining us this evening. It's a pleasure to have you.
Well, thank you very much. It's really nice to be here.
Okay, so we're going to jump right in. And very first question that I have is, I'm sure a lot of people think about this all the time, and that's the warning signs, right? So when we think about stroke and we think about stroke awareness and prevention, what are some of the warning signs that somebody needs to know that they could potentially be having a stroke?
Sure, and that's a very important question because stroke is truly an emergency. And folks need to realize that if they're noticing something that could be a stroke, to call 911 right away. And the most common things that we'll see with stroke would be weakness of the face, droopiness of the face where it's kind of pulling down a little bit, maybe the smile is crooked, weakness of an arm or a leg, especially an arm. And if you're with someone, you're worried they're having a stroke, have them hold their arms up, and if one starts to fall down or can't get up, that's pretty good sign that there could be a stroke going on. And then speech is really important. So slurred speech, or even unable to get the words out. The words just sound gibberish. That can be a sign of a stroke. And those are the things that we look at most commonly, the easiest things to learn about stroke, and time is really important, so calling 911 right away. There are some other things that people can have when they have a stroke that aren't in that kind of simple aspect there, which includes visual loss. Someone loses vision completely on one side, or they can't talk at all. Or maybe they can't walk. They get up and they're losing their balance and they fall over, and it could be a stroke that's affecting their coordination center. And then maybe a smaller stroke might affect just sensation, just go numb on one side of the body. So those are some other things that can happen. And then probably something else that people don't think about a lot, if you have a very sudden, horrible headache that you've never had before, maybe you're nauseous, maybe you're actually throwing up, that can be a sign of a bleeding stroke. And so that's something that also warrants a quick 911 call.
Well, I know that you mentioned in cases like this, time is of the essence. And I'm sure that if somebody is fortunate to have somebody around, friends, family, work colleague, or what have you, what are the very first things? And I know you mentioned 911 certainly, but is there anything else that somebody around an individual that starts to show these signs can do, if they feel like someone is having a stroke?
Right. So if someone's having a stroke that's affecting how they can sit or stand or such, to keep them safe. If someone looks like they're going to fall, et cetera, or if they're eating, stop the food, don't let them put water in, et cetera, because they could choke on that. But really the key is 911, because the treatment's going to be emergent treatment at the hospital if you're having a stroke at that moment. There's really not a lot you can do at home or in the field to stop that stroke.
Mm-hmm. All right. So in regards to prevention, I know that's one of the themes that we want to discuss this evening. I know you just addressed, and you're going to address, what to do in the case of this happening, but there are a lot of things that we can do to prevent strokes. So would love to have you share a little bit about that.
Absolutely. And that is the key. The best way to treat a stroke is to prevent a stroke. And so there are multiple things that can lead to a stroke, and some of the medical conditions that we worry about, high blood pressure probably being the most important that we see. Approximately 80% of people that have a stroke actually have high blood pressure that's poorly controlled, or maybe just not as good as it should be. So that's a big risk factor. seeing your family doctor, your primary care physician, making sure that your good health is intact, including high blood pressure, and treating that. Other things that can lead to a stroke that you worry about would be something, diabetes can lead to that. Smoking. Smoking is a big risk factor for having a stroke of either type, bleeding stroke or an ischemic stroke where there's a clot present. Physical inactivity along with obesity is a risk factor. Cholesterol, hyperlipidemia, you can see on the chart there. High cholesterol is a risk factor as well because the blood vessels are then being blocked up by fatty deposits, which can then lead to a blood clot or blockage of the blood flow. And then a high sodium diet, and that's a very difficult thing to address. We like the diet to have no more than 1,500 milligrams of sodium. And if you look at the processed foods and restaurant foods, et cetera, it's really high to keep that down. So that's something that really has to be focused on. So those are really some key aspects and risk factors for stroke, among some other things.
So we had a question in the chat that kind of leads to my next question. So I thought I'd ask this first, which is, can a stroke be passed down? In other words, is there anything genetic when it comes to symptoms or an individual, having the propensity to have a stroke?
Yeah, that's a great question. So family history is important. If family members do have stroke or even heart attack history, then that puts them at a higher risk for having a stroke. So yes, that is also a risk factor. And often that can be a risk factor because of the medical conditions maybe their parents had, or the father or the mother, they had a stroke, or grandmother. If they had high blood pressure or diabetes uncontrolled, or they smoked 2 packs of cigarettes a day, that may have led to them having a stroke. But sometimes people can be relatively good about those things, maybe have a few risk factors, and there are some genetic factors. People are just more prone to heart disease or stroke than some other people, so there is that aspect.
So I know you mentioned a lot of those different items, but who is at greatest risk for a stroke? Are you able to identify, that per se?
Yeah, so there's a couple ways to look at that. Going back to the risk factors, those that have those risk factors are at the greatest risk. Certainly high blood pressure, again, by numbers. But a heart process such as atrial fibrillation, that's key. 2 to 5 times the chance of having a stroke if you have atrial fibrillation. So that's something that you do want to take seriously if you have that. Have your, work with your doctor to control that. Age is a major risk factor. So over the age of 55 becomes a risk factor for having a stroke, and that's probably the number one risk factor that you really can't control as you get older. So that's very important. And also ethnicity. So Black Americans have almost twice the chance of high blood pressure and stroke. And in Hispanics also it's increased over Caucasians. So there are some other factors in there that can make it difficult.
And we hear a lot of individuals maybe having a lot of high stress in their life. So that kind of leads me to the next question: is maybe some of the different lifestyle habits that can could contribute to an increased risk of stroke. I know you mentioned some of them, but are there any other ones? You hear about stress a lot. I'm curious about what that correlation is with the propensity to have a stroke.
Yeah, it's interesting. So stress makes most medical conditions worse. So stress can lead to a lot of things: poor sleep, poor eating habits, right? You're so busy, you're so upset, you're not eating right, you're not sleeping well. And good health protects you from stroke. So if you can't do good health habits like getting around right amount of sleep or exercising regularly because you're working too much, you don't have time, there's too many things going on, you're a single parent, that can really be a situation that can put you at a poor health risk. Stress itself, if I were very stressed right at this moment, does that increase my risk for stroke? Not a lot, maybe a little bit. It's more the long-term adds to your health issues where stress really comes into play. So it's the long game that you really want to look at with that, working on your stress. With exercise or time alone, maybe meditating or just kind of relaxing out and looking at the sunset or taking some walks, it really can help reduce the stress, and it's important.
Absolutely. All right. So you talked a little bit about prevention. Now let's talk about, the unfortunate situation, somebody does have a stroke, and recovering from that. And is it possible for someone to recover fully from a stroke?
Sure. So let's talk about recovery. Then maybe we can talk about what happens when you have one, because that's
Yes.
kind of a very difficult topic or a very important topic to talk about as well. But recovery is possible, but unfortunately, most people do have some type of disability from a stroke. So if a stroke were to occur, which typically then is you have a blood clot that blocks up a blood vessel and stops the blood flow to the part of the brain, and whatever part of the body that part of your brain is running, that's the part that you see as your symptoms. So if it blocks up the part that's running the right side of the body, you'll be weak on the right side. And so recovery from that, about 10% of people will recover pretty well. They've had a stroke and really go on about their business without really much change, other than, of course, working really hard and changing their medical status and lifestyle not to have another one. About 25% or so will have, maybe closer to 30% will have just a very minor disability, where they may have some numbness or they may not be able to run like they did before, but they could still exercise and still function and go to work. But about 40% will have a disability that's enough that they'll require assistance, like maybe a walker to help with them walk, or a cane, or trouble eating and taking care of all of their aspects at home. So they will have some disability that will be there the rest of their life. And unfortunately, around 10% will be so disabled they'll have to have 24-hour care. So most of the time it's in a long-term facility because of the inability to eat or ambulate and do those types of things. And then, so recovery is possible, and certainly with the physical therapy departments and occupational and speech therapy and all the help that folks get with recovering, really have made a lot of advances in that aspect. But even with that, a majority of people still have some type of deficit. And the other thing to remember is about 15% of people will die from a stroke or soon afterwards. So that's also very important. Stroke is the number 5 cause of death in the United States, but it's either first or second, depends on what data you want to look at, as far as medical disability for adults in the United States. So it's very important.
So we had a question from the audience. One of them is, I recently had a stroke a year ago. What's the best exercising that I can do at home to help regain my feeling back?
All right, so exercise is very good to help the muscle aspect come back. And that would depend upon how much weakness you have and where at, right? If you're able to walk, then walking's still good. If walking is a problem, then maybe a stationary bike or, things, that's where the physical therapists and the other therapists can really help guide. That's very individualized. As far as sensation goes, if someone were to lose their sensation from stroke, exercise is not likely going to help that very much. Time is the healer of that, and really the hope is the brain will start to recircuit and kind of reroute where the injury is and redevelop some of those sensory circuits. And that can take months and months and months. So most people, when they recover from stroke, will have their biggest jump in recovery within about the first 3 months or so. Then it'll feel like it really slows down. And if you went day by day or week by week, folks will just feel like they're just not making any progress. But if you stick with it and give it some time, you may look back in 6 months and say, oh, I'm definitely better than I was 6 months ago. But you only notice it because you remember how you were then. It becomes so gradual at this point. And even beyond a year or two, you can continue.
So I want to go back to prevention just a little bit before we talk about some of the treatment options. And you talked about a lot of the symptoms and the things that could put somebody in that dangerous situation. Do you see often that when people make those changes in their lives? I mean, obviously that minimizes their risk. But I'm just curious, because I think, educating people in the beginning, that's really a big part of a lot of this, right? Is that prevention discussion. Yes. Do you see that a lot? Do you see, that having these conversations with people, more and more educating people on what they can do is helping, minimize this? I mean, just the current trends, I guess you could say, as more people are being educated.
Yeah, absolutely. In the overall realm of stroke over the past couple of decades, and we believe it's because of taking care of risk factors and really people getting educated and being active with that, there's been a reduction in overall stroke incidence by about 16%. Now, that includes everybody, and unfortunately it doesn't include younger folks where that incidence actually has increased, and we can talk about that. But overall, the incidence is down because of education and realizing what folks can do and take control of their lives and be healthier, and following the recommendations of their physicians or other providers. So 16% reduction over the past couple of decades. Actually, death rate's actually down from that as well, and disability. So all the things we're doing are helping, but
Right.
There's still 800,000 strokes a year in the United States. So there's a long ways to go.
Can you touch on a little more what you just shared in regards to younger individuals?
Sure.
It sounds like that percentage is increasing. I'm curious about that.
Yes, so age 18 to 45 is what we consider a young stroke age. And that's actually increased over the last decade by about 44% by a recent study. So that's a big jump. Now, the actual numbers in someone, stroke in someone in their 20s or 30s is relatively low to someone in their 70s and 80s, but it's a relative big jump for young people. So that's very concerning, obviously. And, we don't know exactly why that is, but we do have some ideas. And some of it is physical inactivity and obesity, which is on a rise in the United States. High blood pressure, also more of a problem in folks that aren't as healthy. But there's also some relationship that we found to actually smoking marijuana and other illicit drugs like cocaine, et cetera, do trigger and have the potential to trigger stroke in young people. So there's a variety of things, and we can't really put one thing on it, but it seems to be the whole process is gone that route. And there's a lot of work going into that.
Yeah, that's excellent. Like you said, education. And I think you mentioned education at all age levels,
Right.
as that increases. So we had another question. I know there are many artery scans available as a preventative and predictive screenings. Do these really help identify people at risk for stroke and vascular disease? And which would be the best to participate in?
All right, so good question. So when we talk about stroke, and I mentioned that arteries can get fatty deposits and get blocked up or reduce the flow, which then allows a blood clot to form, which could block that artery and block all the flow past that artery into the brain. And if you think about the blood vessels that go into the brain, really think about it like a tree. And your major arteries, like your carotid artery, you can feel the pulse here, everybody's aware of that big artery. That's the trunk, and then as it goes into the brain, it branches out just like the branches of a tree and gets smaller and smaller. And if a clot forms here, and it's not big enough to block the whole artery, it can travel. And once it gets to a smaller branch, it'll block that one up. So the scans are to look at those blood vessels and see if there's significant blockage, which would then put them at risk for stroke. So they are very helpful from that standpoint. A nice, easy screen is a carotid ultrasound, and that's just an easy ultrasound looking at the blockage from that standpoint. Now, that's not as accurate as some of the other tests, but for a screen, it works just fine. But if you're at high risk or there's a concern or it's part of the evaluation because you've had a stroke-like event already, then other studies look at them closer, like a CAT scan. So you can do a CT or a CAT scan of the arteries as well, and those are very good and non-invasive. You do have to use contrast for that, but it's not, other than an IV, it's not an invasive study, and it's pretty good. MRI also looks at the arteries quite well from that standpoint. CAT scan is a little bit faster, and it gets used a little bit more because of that reason. And then I guess the gold standard you would think about would be a catheter. So it's an awful like a heart cath. You do the same kind of thing to the brain. They'll go into the vessel in the groin, put dye up into the blood vessels and take pictures, and it shows the outline of the blood vessels. And that's really the ultimate at looking at the blood vessels and see how much blockage there are. And then, yes, you can then address that particular cause of stroke if they do have vascular disease.
Yeah, excellent. Very helpful. All right, so let's talk a little bit about treatment options that are available to an individual after they've had a stroke.
All right, so let's talk about the person, or you're with someone and a stroke occurs, and you'll recognize it because you use that FAST acronym that we're all hearing about, right? Face, arm, speech, then time. 911 to the ER, and there are emergent treatments for stroke that have really reduced, again, the incidence of disability and death. And the first and the most common use is something called TPA, which is a clot buster. And so if there's a blood clot in the blood vessel and that can be identified, and it doesn't have a high risk for bleeding because it does break up clots, which therefore risk is a side effect. So if you have a bleeding disorder or you already have blood coming from someplace else, that obviously would be an issue and you wouldn't be able to use that. So there are very strict criteria to be safe. But you can use that up to 4.5 hours after the stroke starts. So it's very important to get there as soon as possible. We can use that. It's just an IV treatment, and it breaks up the blood clot and significantly reduces the chance of having disability afterwards. The most important thing about that is the faster the better. We know the sooner you get it, the less permanent injury there is because you've reestablished that blood flow sooner. So that's why 911, and I want to emphasize that 911 is much faster than getting in a car and driving or taking someone there. And it may sound like common sense that it'd be quicker just to jump in your car and bring your friend or someone you love that way, but we just know over time that the fastest way is by ambulance, and people get that care quicker. So other than that, that's the IV form. For folks that may have a larger blood clot in one of the major arteries, such as the carotid artery or the first couple branches into the brain, the middle cerebral artery, if there's a clot sitting there, which we would see by a CT scan, we can see the CT of the artery, we can see the blood clot. And we also have advanced imaging called CT perfusion. We can actually look at how much of the brain's already been injured and how much just has lack of blood flow that can be saved. Mm-hmm. And if it looks like there's brain that can be saved, then the interventionalists, neurosurgical and neurology interventionists, some interventional radiologists, can actually go in with equipment and then pull the thrombus out, pull the blood clot out. So we can do that in some people up to 24 hours if they fulfill all the criteria. So, but we also know, again, the sooner, the faster, the more brain that's saved. The longer that we wait and the more the delay of getting to the hospital and getting these kind of things done, it's estimated we lose about 1.9 million brain cells a minute for every delay that we have. So I don't know about you, I can't afford 1.9 million brain cells for 1 minute. So we really want to go quickly to get that taken care of.
Yeah, no question. So we had another question, and actually I was thinking about this when you were talking about, some of the different, diagnostic treatments and things like that. What would you say to someone who might not seek treatment due to the fear of some of the associated costs?
Sure. So one of the issues that comes up with a lot of medical care, right? It's very expensive. And if you want to talk just pure cost, then cost is if you have a stroke and you have a disability, and it will just be called, it's going to cost you a lot more.
Yes.
Right? Disability is costly. You may not be able to work anymore. You may need therapy. You may have to go to an extended care facility, which is expensive. So just by pure cost, you're really not saving by not going to the doctor. And hospitals have ways of helping people. Mm-hmm. Absolutely go. There's no way anybody wants someone to have a deficit that would keep them from wanting to go to the hospital and get themselves treated. They can get assistance. They have professionals at every hospital that really work on that with folks. So I would strongly urge not to use that, especially for an emergency. Heart attack, stroke, please don't wait.
Yeah, it's not worth it. And again, like you mentioned, it's something that is on a lot of people's minds. So,
Sure.
to your point, but super important. Another question, is it common to not remember anything from having a stroke when you have to start all over with walking, speaking, etc.?
Yeah, so stroke can affect not only what we've already talked about, the motor and the sensory and the skill aspect of it, but it can affect your thinking, can affect cognition. And actually there's a process where multiple small strokes, some of them silent, you may not even know you have, can lead to a dementia because it can cause just a little bit of an injury that then just builds up over time. A larger stroke may affect that as well, but more likely that'll affect the language aspect of it. So you're relearning language, which could be very difficult. And for some people that may almost seem like they don't remember, but part of it is they may not be able to understand what you're saying or may not be able to get their words out as well. But yes, cognitive problems with stroke are relatively common. That's part of the rehabbing process.
Yeah. So as we look to wrap, I've been asking every guest this for these health chats, and it's more along the lines of kind of what we've gone through, and hopefully we're on the other side of it as we get through this pandemic. But in regards to COVID-19 and stroke, not so much correlation, but you think where I'm getting with this. It's just like, I'm going to imagine you've been having a lot more conversations with patients and the concerns of that, connection and or things that can come from that. So I thought I would ask, why we had this opportunity to have you here.
Sure, and it's really a good question. There is a correlation with increased stroke with COVID. So if you have a COVID infection, your risk does go up. Now, it's not high. The estimate right now is that maybe 1%, 1.5%, maybe 2% of folks with stroke actually had COVID. But that may be their only risk factor. They may have been pretty healthy otherwise. So we know there's some correlation because we believe, based on what we understand, that there's an increased incidence of clotting or causing clots, so heart attacks, strokes, et cetera, could increase with COVID. And these folks are, for the most part, pretty sick with COVID. But so that is a risk. But of course, most people with COVID do not have that. So if you get COVID and you test positive, I wouldn't sit and worry about it so much because the risk is still relatively low. But it is there. But I would also mention that it's important to go to the hospital and get treated because the risk of getting COVID at the hospital is just infinitesimal. Everybody's just so protected and so wary of everybody and trying to stay healthy and testing everybody that it's clearly much more advantageous to go get treatment and not, I guess, worry about catching something.
Yeah. Thanks for sharing that. Like I said, I mean, you never know with a lot of this, and it feels like, at least with some of the guests that we've had, that in hopes that the education for most people, like our own health, has gone up a little bit, right? This has kind of raised the red flag for many of us,
Right.
as we have seen this happen to a lot of people, and so hopefully it's encouraged that more and more people are coming to the hospital. They're preventing it. They're asking questions on the front end. Which is, hopefully going to benefit them. Any last thoughts? I mean, this has been excellent. We talked about prevention. We talked about what to do in the case of, being around somebody where you start to see those symptoms, like you mentioned. But any last thoughts as we close out on such an important topic?
Yeah, I think the last thing I would add is secondary stroke prevention, because if, again, 10% may do pretty well and a percentage will have just mild deficits, there are ways to prevent the next stroke other than modifying your risk factors. There are medications that can be used to thin the blood, medications that can help reduce the cholesterol and also stabilize blood vessels, make them healthier. So follow up with your doctor with those types of treatments, including, again, also changing your lifestyle to prevent anything that could happen again down the road. That's what I would emphasize.
Excellent. And I was looking here. We have one last question here. Well, we got a minute left. Can we have a discussion about knowing the signs of clogged arteries in the heart? Is that relevant to what we're discussing here, or maybe for another health chat?
Yeah, so it's very similar, because the clogged arteries of the heart and for going to the brain, the risk factors are basically the same. So yes, they're very, very similar.
Excellent. Well, listen, Dr. Schoonover, thank you so much. It's been an absolute pleasure. And again, I know every time there's an opportunity to educate the public, this is awesome. I want to let everybody know, for more information, you can go to ketteringhealth.org/services/brain-spine. I know the team is going to go ahead and put that link in the comments. So I went there before we came on live. A lot of great resources and information there about the help that you can get from that organization. So again, Dr. Schoonover, thank you so much for the work that you do, and we'll talk to you soon.
Well, thank you very much. Appreciate it.
We keep going through the hills and valleys life throws, and we face all the challenges we never chose. We can take our doubts and fears and turn them into joyous tears. With the power inside me, and with faith and with passion and a strong family at my side, I can make anything happen.